We now have details on the new expanded lung cancer screening guidelines set forth by the American Cancer Society. The goal is to encourage more adults who currently smoke or used to smoke to get tested for lung cancer. Here's health reporter Gillian Neff.
Getting screened for lung cancer entails a quick low-dose CAT scan of the chest.
We want to find the patients with a lung cancer while they're still feeling fine. We want to find them when they're at the earliest possible stage. At that point, we can cure a patient. We can cure a patient potentially with surgery alone without the need for chemotherapy or radiation.
Stamford Health's Dr. Michael Ebright is armed with high-tech ways to biopsy a potentially cancerous tumor, and if it proves malignant, surgically remove it before it has a chance to grow and spread. He welcomes the updated guidelines that recommend lung cancer screening start earlier, at 50 years old, rather than 55, if you've been smoking a pack of cigarettes a day for 20 years, or if you did in the past. The previous guidance only included people who smoked a pack a day for 30 years and disqualified those who quit more than 15 years ago. Dr. Ebright says that years since quit criteria needed to be dropped since lung cancer risk increases with age. The American Cancer Society says lung cancer is the leading cause of death in the U.S., more deadly than colon, breast, and prostate cancers combined.
By changing our guidelines, we're actually going to increase the number of eligible patients by about 37%, and which means by about 5 million more Americans will now be eligible for lung cancer screening.
It's Lung Cancer Awareness Month. I'm happy to be putting this out there. Unfortunately, lung cancer has a bit of a stigma, very much different from other cancers. People may think, well, it's lung cancer, they brought it on themselves, and that's not true. Not only is smoking addictive and very difficult to quit, many patients stopped smoking or started smoking well before anybody knew it was bad for you. Currently, there are more patients that have quit smoking than are current smokers.
I'm health reporter Gillian Neff, and that's your News 12 Health Report.